Now look at question 1. You hear a GP called Mihiraa talking to a duty doctor. Now read the question.
Dr. Hudson, I'm concerned about Mr. Larry's condition. He's been admitted with acute chest pain and shortness of breath.
Thank you for the update, Dr. Mihiraa. Can you provide more details about his medical history?
He has a history of hypertension and hyperlipidemia. He's also a smoker.
Does he have any family history of heart disease?
Yes, his father passed away from a heart attack at a young age.
We need to consider the possibility of a heart attack or angina. Let's order an electrocardiogram and cardiac enzymes to assess his cardiac status.
I've already ordered those tests. We'll also need to monitor his vital signs closely and administer oxygen therapy.
Good, Dr. Mihiraa. We should also consider administering aspirin to prevent blood clot formation.
I'll discuss the treatment plan with Mr. Larry and his family. It's important to keep them informed about his condition and the steps we're taking.
Now look at question 2. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Larry, I'm going to change your 4-fluid bag now. This is a routine procedure to ensure you receive continuous medication and fluids.
Okay, Mihiraa. Does it hurt?
The procedure itself is usually painless. You might feel a slight pinch when I insert the new needle.
Will it take long?
The process should be quick. I'll adjust the flow rate to ensure you receive the correct amount of fluids.
Mihiraa, what if I feel any discomfort after the 4 change?
If you experience any pain, redness, or swelling at the 4 site, please let me know immediately. We can adjust the 4 or apply a warm compress to alleviate any discomfort.
Okay, Mihiraa, thank you.
Now look at question 3. You hear a doctor called Mihiraa talking to a neurologist. Now read the question.
Dr. Hudson, I'm referring Mr. Larry to your neurology clinic for further evaluation. He's been experiencing persistent headaches and cognitive decline.
Thank you for the referral, Dr. Mihiraa. I'll schedule an appointment for Mr. Larry. Could you provide me with more details about his symptoms?
He's been complaining of headaches that are often accompanied by nausea and vomiting. He's also having difficulty concentrating and remembering things.
Has he noticed any changes in his vision or speech?
Not that he's reported, but we should rule out any neurological disorders that might be causing his symptoms.
I'll perform a thorough neurological examination, including cognitive tests and imaging studies. Dr. Mihiraa, we may also need to consult with other specialists, such as a neuropsychologist or neuro-ophthalmologist, depending on the findings.
Thank you. I appreciate your expertise in diagnosing and managing complex neurological conditions. I look forward to discussing Mr. Larry's case with you further.
Now look at question 4. You hear a doctor called Mihiraa talking to a hospital manager. Now read the question.
Mr. Hudson, I'm writing to express my concern about the state of our current medical equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Dr. Mihiraa. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inaccurate diagnoses, delayed treatments, and increased patient risk. It's essential to invest in modern technology to provide optimal patient care.
I agree, Dr. Mihiraa. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should also prioritize the most critical equipment needs, such as those used in emergency situations or for complex procedures.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient safety and ensure that we have the necessary resources to provide quality care.
Now look at question 5. You hear a nurse called Mihiraa talking to a doctor. Now read the question.
Dr. Hudson, I'm concerned about the recent changes in our duty hours. The increased workload is affecting our ability to provide quality patient care.
I understand your concern, Mihiraa. The new schedule was implemented to optimize staffing and improve efficiency. However, I recognize that it may be challenging for some staff members.
The longer shifts and irregular hours are taking a toll on our physical and mental well-being. We're struggling to balance our work and personal lives.
I agree that the new schedule can be demanding. We need to find a balance between meeting the needs of our patients and ensuring the well-being of our staff.
Perhaps we could consider alternative scheduling options, such as compressed work weeks or flexible shifts. This could help reduce burnout and improve job satisfaction.
That's a good suggestion, Mihiraa. We'll explore different options and seek input from the staff to find a solution that works for everyone.
Now look at question 6. You hear a head nurse called Mihiraa talking to a junior nurse. Now read the question.
Nurse Hudson, I've noticed some inconsistencies in your documentation. It's crucial to maintain accurate and detailed records.
I apologize. I'll be more careful in the future.
It's not just about avoiding errors. Accurate documentation is essential for patient safety and legal compliance. It helps us track progress, identify trends, and make informed decisions about patient care.
I understand, Mihiraa. How can I improve my documentation skills?
Pay attention to detail and use clear and concise language. Avoid using abbreviations and jargon that may be misinterpreted. Document promptly after each patient interaction to ensure accuracy.
Document subjective information objectively. Instead of writing, "patient is in pain," describe the intensity of the pain using a pain scale. This will help us track changes over time and make informed decisions about pain management.
Now look at question 7. You hear a head nurse called Mihiraa talking to the team. Now read the question.
Team, I want to discuss a recent incident involving Mr. Rio. Unfortunately, he had a fall from his bed last night. This is a serious matter that requires immediate attention.
What caused the fall, Mihiraa?
We're still investigating the exact cause, but it's possible that he might have tried to get out of bed unassisted.
Should we consider using bed rails to prevent future incidents?
Bed rails can be effective in preventing falls, but they also have potential risks. We need to weigh the benefits and drawbacks carefully. Perhaps we can implement a bed alarm system to alert staff if Mr. Rio tries to get out of bed.
What about patient education? Can we educate Mr. Rio and his family about fall prevention strategies?
That's a great suggestion. We can provide them with information on how to use call bells, the importance of staying in bed, and the risks of falls.
Mihiraa, we should also review our staffing levels and ensure that we have adequate staff to monitor patients closely.
Absolutely. By addressing these issues, we can reduce the risk of future falls and improve patient safety.
Now look at question 8. You hear a nurse called Mihiraa talking to a patient. Now read the question.
Mr. Rio, I know being in the hospital can be lonely and isolating. It's important to maintain your social connections and find ways to stay connected with loved ones.
Mihiraa, I miss my family and friends. I feel so alone here.
I understand how you feel. Social isolation can have a negative impact on your mental and emotional well-being. Let's see what we can do to help.
I don't have a smartphone, so I can't video call my family.
We can help you connect with your family through video calls. We can also arrange for your family members to visit you, if possible.
That would be great, Mihiraa. I'd really appreciate it.
In the meantime, we can encourage you to engage in social activities within the hospital, such as board games or group activities. We can also provide you with reading materials or other forms of entertainment.
Thank you for your help.
Now look at question 9. You hear a doctor called Mihiraa talking to a head nurse. Now read the question.
Nurse Hilton, I'm concerned about Mr. Rio's condition. His blood pressure is elevated, and he's experiencing chest pain.
Yes, Dr. Mihiraa, I've noticed those changes as well. He seems to be in discomfort.
We need to adjust his medication regimen to manage his blood pressure effectively. Let's increase the dosage of his antihypertensive medication and add a beta blocker to help control his heart rate.
Should we consider any additional medications, such as a diuretic?
That's a good idea. A diuretic can help reduce fluid retention and lower blood pressure. We'll monitor his kidney function closely to avoid any adverse effects.
How often should we monitor his vital signs, Dr. Mihiraa?
We should monitor his blood pressure and heart rate every hour. We'll also need to assess his urine output and electrolyte levels.
I'll inform the nursing staff about the changes in Mr. Rio's medication regimen and monitoring plan.
Now look at question 10. You hear a physiotherapist called Mihiraa talking to a hospital manager. Now read the question.
Mr. Hilton, I'm writing to express my concern about the limitations of our current rehabilitation equipment. Some of our machines are outdated and malfunctioning, which is impacting patient care.
I understand your concern, Mihiraa. We've been facing budget constraints, and it's been difficult to allocate funds for new equipment.
I appreciate the budgetary constraints, but outdated equipment can lead to inefficient therapy sessions and hinder patient recovery. Investing in modern equipment can significantly improve patient outcomes.
I agree, Mihiraa. Perhaps we can explore options like leasing or renting equipment to reduce the initial cost. We could also consider applying for grants or seeking donations from charitable organizations.
That's a good idea. We should prioritize the most critical equipment needs, such as those used for balance training and gait rehabilitation.
I'll discuss this with the finance team and explore potential solutions. We'll prioritize patient care and ensure that we have the necessary resources to provide effective rehabilitation services.
Now look at question 11. You hear a nurse called Mihiraa talking to the team. Now read the question.
Good morning, team. I want to discuss a recent change in hospital policy regarding patient visitation hours. Starting next week, visiting hours will be extended to accommodate more family members and friends.
That's great news, Mihiraa. This will definitely improve patient morale.
Absolutely. We want to create a more welcoming and supportive environment for our patients. However, it's important to maintain a quiet and calm atmosphere in the wards.
How can we ensure that the extended visiting hours don't disrupt patient care?
We'll need to implement strict guidelines for visitors. They should avoid making noise, avoid bringing in outside food, and respect the privacy of other patients. We'll also need to educate visitors about infection control measures, such as hand hygiene.
Mihiraa, will there be any additional staffing requirements to accommodate the increased number of visitors?
We'll assess our staffing needs and adjust our schedules accordingly. We may need to hire additional staff or reassign existing staff to manage the increased workload.
Now look at question 12. You hear a cardiologist called Mihiraa talking to the team. Now read the question.
Team, we have a complex cardiac surgery scheduled for Mr. Rio today. Let's review the patient's medical history and discuss the surgical plan.
Mr. Rio has a history of hypertension and diabetes. Dr. Mihiraa, he's also on several medications, including blood thinners.
We need to carefully manage his medications preoperatively to minimize bleeding risks. Let's consult with his primary care physician to optimize his medication regimen.
What about his allergies? Is he allergic to any medications or latex?
We'll need to double-check his allergy history and ensure that we use latex-free equipment. We should also have emergency medications on hand to manage any adverse reactions.
Should we consider any specific preoperative tests, such as an echocardiogram or stress test?
It would be prudent to review his recent cardiac tests to assess his current cardiac function. We may need to adjust our surgical plan based on the latest findings.
What about post-operative care, Dr. Mihiraa? What kind of monitoring will be required?
We'll need to monitor his vital signs closely and assess for any signs of complications, such as bleeding or infection. We'll also need to manage his pain effectively and provide appropriate rehabilitation.
Now look at question 13. You hear a triage nurse called Mihiraa, talking to the patient's carer. Now read the question.
Mr. Tim, I'm concerned about Mr. Franklin's condition. He's been experiencing shortness of breath and chest pain.
That's concerning. Have you assessed his vital signs, Mihiraa?
Yes, his blood pressure is elevated and his heart rate is rapid. We've administered oxygen and pain medication to alleviate his symptoms.
We should consider transferring him to the emergency department for further evaluation. A cardiac event is a possibility, given his symptoms and medical history.
I agree. We'll prepare him for transfer and notify the emergency department about his condition. We should also contact his cardiologist to inform them of the situation.
Good, Mihiraa. Remember to document all interventions and vital signs. We'll need this information for the emergency department and his ongoing care.
Now look at question 14. You hear a GP called Mihiraa talking to a pharmacist. Now read the question.
Pharmacist Tim, I'm concerned about Mr. Franklin's medication regimen. He's experiencing some side effects from his current medications, including nausea and dizziness.
That's concerning Dr. Mihiraa. Let's review his medication list and identify any potential interactions or adverse effects.
I've checked for interactions, but I can't find anything significant. Perhaps it's an idiosyncratic reaction to one of the medications.
We could try adjusting the dosage or switching to an alternative medication. However, we need to consider the potential impact on his overall health.
That's a good point. We should discuss the risks and benefits of each option with Mr. Franklin. We might also need to consult with a specialist for further advice.
I agree, Dr. Mihiraa. It's important to involve Mr. Franklin in the decision-making process and ensure he understands the potential risks and benefits of each option.
Thank you for your input, Tim. We'll work together to find the best solution for Mr. Franklin.
Now look at question 15. You hear a physiotherapist called Mihiraa talking to an assistant. Now read the question.
Assistant, please prepare the patient for the hydrotherapy session. Ensure the pool temperature is maintained at the optimal level and the necessary equipment is ready.
Certainly, Mihiraa. Should I assist the patient into the pool or would you prefer to do it yourself?
I'll assist the patient. Please ensure the pool area is clean and free of any potential hazards. Double-check the water quality and pH levels.
Yes, of course. Should I prepare the exercise plan for the session?
That would be helpful. Please review the patient's medical history and tailor the exercises accordingly. We need to focus on improving their range of motion and strength.
Any specific exercises you'd like me to emphasize, Mihiraa?
Prioritize exercises that target the affected areas, such as the knee and ankle. We can incorporate balance exercises to enhance stability and prevent falls.
I'll prepare the necessary equipment and assist you during the session.
Now look at question 16. You hear an occupational therapist called Mihiraa talking to a nurse. Now read the question.
Nurse Tim, I'm concerned about Mr. Franklin's progress in occupational therapy. He's struggling with activities of daily living, particularly dressing and grooming.
That's concerning Mihiraa. Has he been experiencing any pain or discomfort?
He's reported some stiffness and weakness in his upper extremities. We need to address these issues to improve his functional independence.
Perhaps we should consult with a physical therapist to develop a comprehensive rehabilitation plan.
That's a good idea. A combined approach from occupational and physical therapy can be beneficial. We can work together to improve his strength, coordination, and fine motor skills.
How can we motivate Mr. Franklin to participate actively in therapy sessions?
We can set realistic goals and celebrate his achievements, no matter how small. Positive reinforcement can boost his confidence and encourage him to keep working hard.
Mihiraa, we should also involve his family in the rehabilitation process. They can provide support and encouragement at home.
Absolutely. Family support is crucial for successful rehabilitation. We can educate them on how to assist Mr. Franklin with daily activities and provide them with specific exercises to practice at home.
Now look at question 17. You hear a head nurse called Mihiraa conducting an induction program for junior nurses. Now read the question.
Welcome to our team, new nurses. This induction program is designed to familiarize you with our hospital's policies, procedures, and culture.
Thank you, Mihiraa. We're excited to be part of this team.
To ensure patient safety, it's crucial to follow our infection control guidelines meticulously. This includes proper hand hygiene, wearing appropriate personal protective equipment, and adhering to isolation precautions.
How do we prioritize tasks and manage our time effectively?
Effective time management is essential in our fast-paced environment. Prioritize tasks based on urgency and importance. Use tools like time management techniques to organize your workload.
What are the communication protocols we should follow?
Clear and concise communication is vital in healthcare. Use SBR, situation, background, assessment, and recommendation when reporting patient conditions to ensure effective communication.
How can we maintain a positive attitude and manage stress, Mihiraa?
Self-care is crucial. Practice stress management techniques like mindfulness and meditation. Seek support from colleagues and supervisors when needed.
Now look at question 18. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Tim, I'm concerned about Mr. Franklin's condition. His blood pressure is elevated, and he's complaining of chest pain.
Yes, Dr. Mihiraa, I've noticed those changes as well. He seems to be in discomfort.
We need to act quickly to prevent any complications. Let's administer oxygen and monitor his vital signs closely. We should also consider administering nitroglycerin to relieve the chest pain.
Should we prepare for a possible cardiac event?
It's always best to be prepared. Let's have the cardiac arrest team on standby and ensure that all necessary equipment is readily available.
What about pain management, Dr. Mihiraa?
We can administer additional pain medication as needed, but we should prioritize managing his underlying condition.
I'll inform the team about the changes in Mr. Franklin's condition and ensure that they're prepared to respond to any emergencies.
Now look at question 19. You hear a head nurse called Mihiraa conducting a meeting. Now read the question.
Good morning, team. Today, I'm excited to introduce our new uniform. This new design is not just a change in appearance, but a significant step towards enhancing our professionalism and patient comfort.
What are the key features of the new uniform, Mihiraa?
The new uniform is designed to be both functional and stylish. It's made of breathable, moisture-wicking fabric to keep you comfortable during long shifts. The pockets are strategically placed for easy access to essential items like pens, stethoscopes, and mobile phones.
Will the new uniform be more durable and easier to maintain?
Absolutely. The fabric is durable and stain-resistant, making it easier to clean and maintain. The new design also incorporates antimicrobial properties to reduce the risk of infection.
How does the new uniform contribute to patient safety?
The new uniform is designed to be easily identifiable, which can help patients recognize healthcare professionals. It also promotes a professional image and builds trust with patients and their families.
When will we start wearing the new uniforms, Mihiraa?
We'll transition to the new uniforms gradually over the next few months. In the meantime, please continue to wear the current uniforms until further notice.
Now look at question 20. You hear a doctor called Mihiraa talking to a cardiologist. Now read the question.
Dr. Benson, I'm concerned about Mr. Liston's recent cardiac event. He's experiencing chest pain and shortness of breath.
That's concerning, Dr. Mihiraa. We need to act quickly to prevent further complications. Let's start him on aggressive medical therapy, including antiplatelet agents, beta blockers, and statins.
I agree. We should also consider cardiac rehabilitation to improve his functional capacity and reduce the risk of future events.
We may need to discuss revascularization options, such as angioplasty or bypass surgery if medical therapy proves ineffective.
Dr. Mihiraa, let's monitor his response to medical therapy and reevaluate his condition in a few weeks. We can make a decision about revascularization at that time.
It's important to educate Mr. Liston about lifestyle modifications, including a healthy diet, regular exercise, and smoking cessation. These changes can significantly improve his prognosis.
Now look at question 21. You hear a physiotherapist called Mihiraa talking to a patient. Now read the question. Mr. Liston, I'm pleased to see your progress in physical therapy. Your range of motion has improved significantly.
Thank you, Mihiraa. I've been working hard on my exercises.
I'm impressed with your dedication. Let's continue with the exercises we've been doing and incorporate some new ones to challenge your muscles.
Great. I'm ready to push myself.
Remember to listen to your body and avoid overexerting yourself. It's important to balance exercise with rest.
I'll be careful, Mihiraa. I don't want to set myself back.
That's important. We'll gradually increase the intensity of the exercises as you improve. Are you experiencing any pain or discomfort during the exercises?
A little soreness, but it's manageable.
That's normal. As your muscles get stronger, the soreness should subside. If the pain becomes severe or persistent, let me know.
Now look at question 22. You hear a neurologist called Mihiraa talking to a nurse. Now read the question.
Nurse Benson, I'm excited about the new patient monitoring system we're implementing. It will significantly enhance our ability to track vital signs and detect early signs of deterioration.
That's great news, Dr. Mihiraa. How will this system benefit our patients?
By continuously monitoring vital signs, we can identify trends and intervene early to prevent complications. The system will also alert us to any significant changes, allowing us to respond promptly.
Will this system reduce the workload for nurses?
While it won't eliminate the need for hands-on nursing care, it will streamline our workflow and reduce the frequency of manual vital sign checks. This will allow nurses to focus on providing direct patient care.
Dr. Mihiraa, how will this system affect patient privacy and data security?
The system is designed to protect patient privacy and comply with data security regulations. Access to patient data will be restricted to authorized personnel, and strict measures will be in place to prevent unauthorized access.
I'm looking forward to seeing how this new system improves patient care. Now look at question 23. You hear a GP called Mihiraa talking to a staff nurse. Now read the question.
Nurse Benson, I'm excited about the new patient token system we're implementing. This will help us manage patient flow more efficiently and reduce wait times.
That's great news, Dr. Mihiraa. How will this system work?
Patients will receive a token upon arrival, and they'll be called in order of their token number. This will help us prioritize urgent cases and minimize waiting times.
Will this system help us reduce overcrowding in the waiting area?
Absolutely. By managing patient flow more effectively, we can avoid long queues and create a more comfortable waiting environment for our patients.
How will this system impact our appointment scheduling?
We'll need to adjust our appointment scheduling to align with the new token system. We may need to allocate specific time slots for urgent cases to ensure timely care.
Dr. Mihiraa, will this system be easy to use for both patients and staff?
Yes. The system is user-friendly and easy to understand. We'll provide training to our staff and patients to ensure a smooth transition.
Now look at question 24. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Have you seen the new patient, Mr. Liston? He seems quite frail and disoriented.
We need to assess his cognitive function and risk of falls. Perhaps a geriatric evaluation would be beneficial.
That's a good idea. We should also consider consulting with a physical therapist to develop a tailored exercise plan to improve his strength and balance.
We should also involve the social worker to assess his social support system and identify any potential barriers to care.
That's a great point. A multidisciplinary approach is essential to address his complex needs.
Now look at question 25. You hear a nursing manager called Mihiraa conducting a meeting. Now read the question.
Good morning, team. I'm excited to announce the implementation of a new pre-procedure checklist. This is a critical step towards enhancing patient safety and standardizing our care processes. The checklist covers essential items like patient identification, allergies, consent, equipment readiness, and timeouts. It's designed to be completed collaboratively with the entire care team, ensuring everyone is on the same page. Remember, this checklist is not meant to replace clinical judgment, but rather to supplement it. It's a tool to help us catch potential oversights and reduce errors. I understand there might be an initial adjustment period as we integrate this into our workflow. We'll provide comprehensive training and support to ensure a smooth transition. Our ultimate goal is to create a safer environment for our patients. Please familiarize yourselves with the checklist and provide feedback as we move forward.
Now look at question 26. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'd like to discuss the possibility of conducting a lecture session for the nursing staff on the latest advancements in diabetes management.
That's a great idea, Dr. Mihiraa. Our staff could benefit from updated information on the latest treatment options and best practices.
Exactly. I can cover topics such as new medications, insulin pump therapy, and patient education strategies. We can also discuss the importance of early detection and prevention of diabetes complications.
That would be very beneficial. How long do you think the lecture will take?
I estimate around 45 minutes to an hour, depending on the level of interest and questions from the staff.
We can schedule it during our monthly staff meeting, Dr. Mihiraa. I'll coordinate with the nursing team and ensure everyone is available.
Thank you. I'm looking forward to sharing my knowledge and expertise with the nursing staff.
Now look at question 27. You hear a nurse called Mihiraa talking to a colleague. Now read the question.
Mihiraa, I need you to keep a close eye on Mrs. Paul in room 302. She's post-op from a hip replacement and is at risk for delirium. We've seen an increase in post-operative delirium cases lately. Ensure she's oriented to time, place, and person. Encourage early mobilization as soon as possible.
Understood, Linda. I'll make sure to reorient her frequently and assist with ambulation. Should I be monitoring her vital signs more closely?
Absolutely. We want to catch any early signs of infection or complications. Also, pay attention to her pain management. Uncontrolled pain can contribute to delirium. Make sure she's comfortable.
Will do. I'll keep an eye on her pain levels and administer pain medication as ordered. Should I involve the physical therapy team earlier than usual?
That's a good point, Mihiraa. Early mobilization is crucial for preventing complications. Let's get them involved tomorrow morning. The goal is to get her out of bed and walk as soon as possible.
Now look at question 28. You hear a GP called Mihiraa talking to a neurologist. Now read the question.
Dr. Paul, I'm referring Mr. George to your neurology clinic for further evaluation. He's been experiencing persistent headaches and cognitive decline.
Thank you for the referral, Dr. Mihiraa. I'll schedule an appointment for Mr. George. Could you provide me with more details about his symptoms?
He's been complaining of headaches that are often accompanied by nausea and vomiting. He's also having difficulty concentrating and remembering things.
Has he experienced any changes in his vision or speech?
No, his vision and speech seem to be unaffected. However, he's been feeling more fatigued and irritable than usual.
We'll need to conduct a thorough neurological examination, including cognitive tests and imaging studies. Dr. Mihiraa, we may also need to rule out any underlying medical conditions that could be contributing to his symptoms.
Thank you. I appreciate your prompt attention to this matter. Please let me know if you need any further information.
Now look at question 29. You hear a head nurse called Mihiraa talking to the nursing staff. Now read the question.
All right, nurses, let's address the new tablet system. I know there's been a learning curve. The primary goal of the system is to streamline patient data access and improve efficiency. You can input vital signs, medication administration, and progress notes directly.
What about patient allergies? How do we ensure they're clearly visible?
Excellent question. The allergy information is displayed prominently in red at the top of the patient profile. Also, there's a function to flag severe allergies for quick reference during medication administration.
I'm worried about battery life. What if the tablet dies during a code blue?
We anticipated that. The tablets have extended battery life and can be quickly swapped. In Code Blue, we prioritize paper charts as a backup, but the tablet data will be synced once the emergency is over.
Will there be training for everyone? I'm still struggling with the medication module.
Absolutely. We're rolling out mandatory training sessions next week. There will also be online tutorials and a dedicated help desk. Remember, this system is a tool to enhance patient care, not a hindrance. Let's focus on adapting and utilizing its full potential.
Now look at question 30. You hear a nurse called Mihiraa talking to a physiotherapist. Now read the question.
Mihiraa, I'm concerned about Mr. Paul's progress. His physiotherapy sessions aren't showing the expected improvement in his knee mobility.
That's interesting. Has there been any increase in pain or swelling?
Not really. The pain is manageable, but there seems to be a plateau in his range of motion. I've tried different techniques, but nothing seems to be making a significant difference.
We might need to consider other factors. Has there been any change in his medication or overall health condition?
He's been on the same medication for a while now. His blood pressure is slightly elevated, but that's been managed.
Let's schedule a follow-up appointment to assess him thoroughly. We might need to order some additional tests to rule out any underlying issues. It's possible there's an underlying condition affecting his knee recovery.
That makes sense, Mihiraa. I'll schedule the appointment. In the meantime, I'll focus on strengthening the muscles around his knee and providing pain relief.
Now look at question 31. You hear a pharmacist called Mihiraa talking to a patient. Now read the question.
Mihiraa, the anti-dandruff shampoo you've been using contains ketoconazole, which can be quite harsh on your scalp if overused. Let's try this new formulation. It combines salicylic acid with pyrithione zinc for a more gentle yet effective approach. Remember, consistency is key. Use it twice a week for a month, then reduce to once a week for maintenance.
Okay, but I've heard salicylic acid can dry out my hair. I have slightly curly hair, and it's already a bit frizzy.
That's a valid concern. While salicylic acid does exfoliate the scalp, helping to remove dandruff flakes, this formula is balanced with moisturizing agents. You might notice a slight increase in dryness initially, but it should be regulated. If it persists, consider a deep conditioner once a week.
All right, I'll give it a shot. But what about my hair color? I've heard some dandruff treatments can affect hair color.
This product is color safe. However, if you've recently colored your hair, Mihiraa, it's always wise to do a strand test before full application. This product is primarily focused on scalp health, but it might indirectly improve hair texture over time due to a healthier scalp environment.
Now look at question 32. You hear an occupational therapist called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's comfort while in bed. We need to ensure he has the appropriate type of bed to prevent pressure ulcers and promote mobility.
That's a good point, Mihiraa. I know we have a variety of beds available. Which type would be best for him?
Given Mr. George's condition, an adjustable electric bed would be most suitable. It allows for easy positioning and can help prevent pressure ulcers by reducing pressure points.
I see. Are there any specific features we should look for in an adjustable bed?
The bed should have multiple adjustable positions, including head, foot, and backrest. It should also have a strong frame to support Mr. George's weight. Additionally, consider features like side rails and alarms for added safety.
Mihiraa, we have some adjustable beds available in the ward. I'll check their specifications and see if they meet Mr. George's needs.
That's great. We want to ensure that Mr. George is comfortable and has the best possible support while in bed.
Now look at question 33. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's recent echocardiogram. The ejection fraction has decreased significantly. We need to discuss a more aggressive treatment plan.
I understand Dr. Mihiraa. His symptoms have been worsening, and he's been experiencing more fatigue.
We should consider increasing his beta blocker dosage. It can help improve heart function and reduce symptoms.
I'll inform the patient and monitor his response to the increased dosage. Should we also adjust his diuretic?
Let's reassess his fluid status and adjust the diuretic accordingly. We want to manage his congestive heart failure symptoms while avoiding excessive fluid retention.
I'll also ensure he's adhering to his sodium-restricted diet and limiting fluid intake.
That's important. We should also discuss the possibility of a cardiac rehabilitation program. It can help improve his overall heart health and reduce symptoms.
I'll schedule a consultation with the cardiac rehabilitation team, Dr. Mihiraa.
Now look at question 34. You hear a GP called Mihiraa talking to a neurologist. Now read the question. Mihiraa, I'm calling about a patient, Mrs. Paul. She experienced her first seizure yesterday. It lasted about 2 minutes with tonic-clonic movements. No loss of consciousness, but she was disoriented afterward. Her medical history is significant for hypertension and type 2 diabetes, but no prior neurological issues.
A first seizure in a patient with no neurological history is certainly concerning. Did she experience any aura before the seizure? And what about postictal symptoms other than disorientation?
No aura was reported, and the disorientation cleared within an hour. I've ordered an EEG and blood work to rule out metabolic causes. I'm leaning towards a possible focal seizure, given the absence of a prolonged postictal phase.
That's a possibility. Given her age and medical history, I'd also consider the possibility of a transient ischemic attack mimicking a seizure. We need to rule out vascular causes. A brain MRI would be helpful to assess for any structural abnormalities.
That's a good point, Mihiraa. I'll schedule the MRI as well. The patient is understandably anxious. I want to avoid unnecessary tests but ensure thorough evaluation. Now look at question 35. You hear a hospital director called Mihiraa talking to the surgeons. Now read the question.
Team, I'm excited to announce that we'll be integrating AI technology into our surgical procedures. This groundbreaking advancement has the potential to revolutionize the field of surgery.
That's incredible, Mihiraa. How will AI be used in the operating room?
AI can assist in various aspects of surgery, from preoperative planning to intraoperative guidance. For example, it can analyze medical images, identify anatomical landmarks, and provide real-time feedback during procedures.
Will AI replace surgeons?
Absolutely not. AI is intended to augment the capabilities of surgeons, not replace them. It will serve as a valuable tool to enhance precision, minimize errors, and improve patient outcomes.
Are there any concerns about the safety and reliability of AI in surgery, Mihiraa?
We've conducted rigorous testing and validation to ensure the safety and effectiveness of the AI technology. However, it's important to maintain human oversight and judgment throughout the surgical process.
Now look at question 36. You hear a nurse called Mihiraa talking to a junior nurse. Now read the question.
Ashley, today we're going to discuss the importance of triage in emergency situations. Triage is a system used to prioritize patient care based on the severity of their condition.
I understand, Mihiraa. I've seen triage in action, but I'm not sure about the specific criteria used to prioritize patients.
Triage typically uses a color-coded system to categorize patients. Red indicates immediate life-threatening conditions, yellow represents urgent, but not immediately life-threatening conditions, green signifies minor injuries, and black indicates deceased patients.
That's helpful. How do we determine the color code for a patient?
We assess the patient's ABCs: airway, breathing, and circulation. If a patient is unresponsive, not breathing, or has no pulse, they are immediately classified as red. Other factors to consider include severe bleeding, chest pain, or difficulty breathing.
Mihiraa, what if a patient's condition deteriorates during the triage process?
If a patient's condition worsens, their triage category may need to be revised. It's important to remain flexible and adjust the triage system as needed.